I'm Myra and sorry. Hopefully, you are somewhere warm and safe right now with this winter weather that's been impacting our area. So, we're going to UofL Health today, where a doctor is talking to us about how to stay safe in this winter weather. UofL Health has seen at least 10 patients with cold related injuries or illnesses, ranging from cold weather exposure to falls. So, today we're joining them to talk about just ways that you can stay safe in this winter weather.
And I'm an attending in the ER at UofL and work for UofL Health, and then a professor of emergency medicine with UofL.
Beautiful. So today we're talking a little bit about cold weather illnesses and cold weather injuries. Obviously, the snow has stopped, but these cold temperatures seem to be sticking around at least through the rest of the week. So there's still some things that people can be aware of to protect themselves. Checking in with our hospital emergency departments across the system. So I'm talking about UofL Hospital, Jewish Hospital, and Mary and Elizabeth Hospital. We have seen at least 15 falls from the ice, at least 7 patients coming in because of exposure to the cold weather. So, Dr. Huecker, we wanted to just talk to you a little bit about what people can do to stay aware and to stay safe. Firstly, I want to talk about these falls. You know, you hear people falling from being on the ice. How serious can these injuries be from something like that?
Well, pretty serious. I mean, I would say head trauma might be the most concerning. If you fall and hit your head, you could have a head bleed. We call it an intracranial hemorrhage that it can kill you. So that's really concerning. Of course, you fall and break a hip. At an elderly person who does that has a higher mortality over the next year. So then you have minor stuff that's an inconvenience, but affects your life, break your arm, your leg. So yeah, it is a big spectrum, but can definitely be pretty life altering to fall when, out in this ice. Yeah.
What do you suggest people do just to stay a little bit safer?
I'd say good advice that I try to give myself and family is slow down. So, when you're out there in the ice, just have respect for it. Even if you're in a hurry, don't try to run on the ice. My son and I were running into the store yesterday and I'm like trying to tell him, don't slip and fall in this. So yeah, just take your time, watch where you're stepping. Don't rush and kind of knowing how to fall and learning how to fall is an important skill that we can teach our family members. Like the way you fall will have a big impact on if you get injured or not.
With that, what is the right way to fall or a better way to fall?
Great. Yeah, good call. So you kind of want to fall like down and land more on like your flank and chest and kind of soften the blow and roll into it. A lot of people will land just right on their shoulder and break the humerus bone here or their shoulder. The fouche injury, we call it, falling on an outstretched hand. You'll have some wrist fractures. Of course, the worst thing you can do is fall back or forward and hit your head. I mean, you want to protect the head as much as possible. So I'd much rather land on my elbow or shoulder than land on my head. And that how to fall is knowing you're going down, having the reflexes to soften the blow and on your way down and not land on your face or head.
Excellent advice, because I feel like I usually end up landing on my tailbone. So I'll try to be cautious of that if I venture outside. And with that said, a lot of people I think are venturing outside today, especially after possibly being cooped up the last 2 days. So with that comes exposure to these cold temperatures. What are some of the illnesses that you see when it comes to exposure? And maybe how long should people be staying outside, especially if they're just trying to take care of their driveway and shovel? What's kind of the timing to make sure that you're staying safe?
Yeah, so the exposure, the two big ones are hypothermia, accidental hypothermia, which is your whole body, the temperature goes down, which can again be deadly, can cause mental status changes. As you start to get cold, you might not realize you're getting so cold, and then it could become too late to have the awareness to come back inside. So that's hypothermia, and then there's frostbite. So that's injuries to the hands, feet, nose, ears. And so those are kind of separate. We keep those separate in our minds. Someone could have perfectly normal body temperature, but have frostbite of the hands. Or at the same time, they might have protected hands and feet and not develop frostbite, but they get dangerously low core temperature, below 90 or even 85 degrees Fahrenheit. And so that can be deadly as well. So the time it's kind of tough. It depends a little bit on if you're acclimated to it. If you are used to being outside and have the proper gear and plenty of thick gloves and boots and socks, then you could stay out there a little bit longer. But when you're seeing these temperatures getting as low as they are, the wind dramatically increases the rate that our body cools in this. Pavement, that's why people without homes who are downtown sometimes laying on concrete, like concrete really takes your heat away. And so wind, water, if anyone's ever found in water, so where you could shovel your driveway in the proper gear for an hour and be okay, if you fell down in a pile of snow or a puddle, with some moisture there, in 5 or 10 minutes, you could be, dangerous, like life-threatening level of hypothermia. So, so the time, it's tough to, give one number, but I'd say like 30 to 60 minutes. You might want to be coming inside, checking on hands and feet, like seeing how you feel, and then you can always go back out there and finish the driveway.
And are there certain home remedies people can do, if something isn't too severe before they need to go to the ER, if they're starting to feel some of those tingling sensations that might be representative of frostbite, for example?
Yeah. So the one important thing to know about frostbite is if you do have a really like a bad frostbite injury, or you think you might be developing frostbite, you want to make sure you don't want to re-warm someone and then re-expose to the cold. That's really important out in the mountains and stuff. So if you can get out of the field, get into your house, yes, of course, start rewarming. One really good bit of advice is do not use hot water or like a space heater that gets really hot, because if you come in and your hands are kind of numb, you don't feel the heat, of course. And so we have people with heat and with thermal injuries like burns to the hands or feet because they put it into hot water in a bathtub or used a space heater that was really hot. And so that, because you can't feel numb digits, you can actually cause heat injury, cause burns. So definitely just coming in, getting out of the environment, getting all the gloves and socks off. You want dry, and then you can dip into lukewarm water. That will help you warm your body up pretty quickly. But yeah, if there's any concern, if you see really bad discoloration that won't go away, if your feeling and sensation is not returning to normal, definitely come to the ER and we'll help you out.
Wonderful. At this point, I want to open it up to any questions that we might have to folks that are tuning in right now.
Hey, doctor, can you hear me? It's Myra from Wave.
Yes. Mhm.
Hey, can you just give us some sledding safety tips? I think a lot of kiddos or adults are going to be out doing that as well now that the roads are getting a little bit better.
Great. Yeah, we were walking in Cherokee, walking the dogs yesterday, and saw tons of people sledding. It was awesome. Yeah, I would say you've got the cold exposure, all that same advice. Make sure you're bundled up, protect the hands and feet and face. And so, you start to feel pretty hot. You can actually sweat a lot underneath all of that gear and get dehydrated. That's a common thing, even out in the cold, you feel like dehydration is a summer thing, but you can get pretty dehydrated out there sledding. So there's all the exposure and temperature considerations. And then, of course, as a trauma ER doc, I have to say, be careful with trauma, so, look at your sled path, make sure you're not going to run into a road, of course, make sure you're not hitting trees or rocks, that sort of thing. So making sure it's a safe environment to sled. It's general common sense stuff, but sometimes in the heat of the moment, you're having fun and you want to go faster and faster, and you can get injured pretty badly.
I think sometimes kids too, going down on your belly with your face facing is a bad idea too, right?
Yeah, I would say, within reason, like if it's a really fast hill and you can't control where you're going, of course you could land on your face, injure your neck, face, head injury, that kind of thing. And so I'd say it's across the board much safer to go feet first, sure.
We do have another question as well. Have you seen any deaths from heart attacks caused by shoveling snow? Or if you can at least talk about how, shoveling in the cold can affect your heart.
Yeah, great question. So it is more stressful for the body to exercise in cold weather than in standard temperatures, and so you have the extra stress on the body. We call it vasoconstriction. Your blood vessels clamp down to conserve heat, and so if you're exerting yourself, shoveling or doing any kind of activity out in the cold, you constrict your vessels, which lowers blood flow. It's more stressful on the body. And so that is a phenomenon that's often described where the man who or woman who generally tolerates exercise okay, you put them out there shoveling snow in the cold, and all of a sudden they have a heart attack, and it's a demand of blood flow kind of problem to the heart. So yeah, very very important to think about. Like you might walk a mile around your neighborhood with no problem, but doing that in the cold, throwing in some muscle exertion, shoveling, or anything else you're doing out here in the cold is actually more stressful for the body and could harm you. Yes.
So is it just important in that case to just know your body, and what kind of signs should you recognize if you're just out there shoveling and something may not feel right?
Yeah, so the signs of a heart attack or low blood flow to the heart, chest pain is the classic one, but a lot of people have silent heart attacks where you don't even have chest pain, shortness of breath, nausea, sweating. If all of a sudden you break out into a sweat, I always say if the patient is sweating, the doctor should be sweating. So that's something that is very important for knowing, low blood flow or heart attack. So those are the big ones: trouble breathing, radiation of chest pain to the arms or jaw, sweating, nausea. Those, if you have any of those signs while you're shoveling snow, stop, come inside, and think about potentially coming to the ER.
Thank you for that question, Addie. She also asks, what should people do who are having back pain after shoveling the heavy snow and ice?
That's, tough. Like a little bit of muscle pain from doing an activity you don't usually do probably can just, like take it easy in the house. We don't recommend bed rest. I see a lot of patients for back pain. Of course, it's like a major cause of disability in the country and world. But you don't want to come in and just lay down. You want to keep walking. You want to stretch a little bit, but you should stop that high exertion activity. Like, don't go shovel anymore. If you feel like you hurt it suddenly, or if you're just sore from shoveling, don't do anything crazy, but walk around, do some stretches. You can take a little bit of Tylenol or ibuprofen. And most of that, if it's not severe pain, it's going to get better over a couple of days.
Excellent. Do we have any other questions? Wonderful. Dr. Hecker, is there any last words you want to say? Again, the snow is done, right? But it's still going to be sticking around outside for a while, especially as these temperatures continue to stay below freezing.
Yeah, I feel like we didn't. I worked in the ER Sunday, and it didn't feel very busy, but it was during all of that downpour. So that's kind of thing that almost keeps us inside and off the roads and safe. But then once the snow stops, everyone wants to run out there and enjoy it. And so, I'm glad you guys are educating the public and getting the word out that cold can still harm you, the falls. I recommend people get out there. I love going out in the cold. It makes you tougher, makes you more able to handle stress, but within reason. You gotta respect the body and listen to your body.
Do it responsibly.
Yes.
Awesome. Thank you so much, Dr. Hicker. I appreciate your time. I know you've got a busy day ahead. Thank you all for tuning in. I'm going to go ahead and stop recording, but I will send out a link.
All right, folks, thanks so much for staying with me here on this stream from UofL Health. Hopefully you got some really helpful information about how to stay safe with this winter weather that we're having. Of course, now it's not dealing with the snow coming down, but just how cold it is outside. So definitely be careful if you are going down. Things like falls can happen very easily. Slow down. The doctor talked about if you kind of you're going down, you're falling, right? How to properly fall. He talked about that. Land on your elbow or your shoulder. That's probably your best bet instead of falling on your hand, or you don't want a head injury either. Okay, so lots of great info there. We're going to continue to follow all this winter weather impacting us. I hope you guys are doing okay. We will have an update from the governor coming up at noon today as well. So stay with us here on Wave Now. Have a great day.